The design vision for the Fife Orthopaedic Centre is to create a building of simple use, clarity and layout for patients, staff and anyone who's using the building to come and understand where they are and why they're there and how they move around the building. It sounds in a way a very simple thing to say, but it's a very hard thing to achieve in design.
The design relates directly to response to the pandemic, in that it is one of a series of centres which is responding to the backlog in patients, as particularly in orthopaedic care, which tended to be have reduced capacity after the pandemic.
Healthcare buildings are by their nature internal buildings, so part of the design field was to look to how we create external environments, which then supplemented and improved the internal environments of the healthcare, and the two of them interact with each other. Positive healthcare comes from that vision of therapeutic access to green areas, to outside spaces, as well as to the clinical environments.
The greatest opportunities within this project are obviously within the site itself. When we came here, it was a car park. There was nothing here. We were obviously looking at how we could develop it. We looked at a number of options, whether it was going to be a 2-storey or 3-storey building. And then we realised that if we could carefully position the building on the site, we could maximise opportunities within it. So we could create some public spaces around the building. We could shelter the building from the neighbouring spaces. So we could create green spaces which were currently didn't exist within the campus.
The design of the Fife Elective Centre is all oriented towards the use of the building and the patient experience and how people come and enjoy, because buildings should be there for enjoyment as well as recovery and repair, to enjoy the use of the building. It has a simple clarity of how the spaces are laid to each other, how each of the elements are put in adjacency to each other, and those very simple placing of the building blocks is subliminal to those who use the building, but are very, very functional to the people who then come to provide the care and look after the patients within that. And the front of house sign, which the patients use and staff use, it is there to give them a welcoming environment so they can then enjoy their workplace to give better outcomes in their care and treatment to those who come to the centre.
We created a central staff kitchen table where everyone gets around and gathers as a family during the day. We created pockets of space at the end of corridors, which would often overlooked spaces, but have actually proved really useful spaces for patients and staff to actually meet or rest or become a goal for rehabilitation within the bedrooms.
The greatest challenges in achieving the vision is more often than not the client, because they arrive with a complexity and an understanding of what they want their building to be and how their building to work. And our role and our task is to take that information from them, to understand the real need for what they're trying to provide, and then provide them with a building that is easier to use, simpler to understand, and get better benefits and outcomes from the staff and patients who are using it.
In some ways we were always aiming at a kind of almost an Apple type product, where it was a very simple, clean aesthetic. Healthcare environments are inevitably busy and difficult and cluttered and quite emotionally fraught. So it really was about creating that very, very pared back aesthetic around the building and internally as well. And that meant that it also sat as itself and set a precedent for the rest of the campus. The rest of the campus has a very busy and difficult set of aesthetic criteria, and so it set up a really high quality building around which all the other elements can sit.
The success of the Fife Orthopaedic Centre is twofold. The architectural success is one that we judge ourselves, and we are always our least critics when we come to see what we have achieved. The real measure of the success of the building is the patients and the staff and the outcomes that come from that. That is the true measure of how the building will ultimately perform long term. The envelope and how we design will last, but if the patient outcomes continue to improve, then the success of the design is there for all to see.